The vasculitides encompass a wide range of rare diseases. So large epidemiologic studies are more rare than in some of our other rheumatic diseases. But overall, the morbidity and mortality from vasculitis has improved with better methods for detection as well as treatment. Despite these improvements, the percentage of vasculitis deaths was higher in females than in males, and this holds true even when we adjust for age. We do know that certain vasculitides are more common in females, and this specifically includes the large vessel vasculitides, giant cell arteritis, and Takayasu's. In GCA, or giant cell arteritis, elderly women are most commonly affected, and prompt diagnosis is critical for preventing vision loss. High-dose corticosteroids are used for controlling this inflammation, and until recently, the diagnosis essentially meant that patients would have to be on high doses of steroids for a very long time. This comes with all the side effects of prednisone that we're aware of in an elderly population that may have concomitant cardiovascular disease, which is also underrecognized in women, diabetes, osteoporosis, or other comorbidities. Male and female patients present with similar clinical, radiographic, and serologic features overall. However, in one study, male patients complained more often of a temporal headache, although the incidence of positive biopsy findings was similar in males and females. Headaches are one of those clues that alert a physician to look for GCA, and females had a longer time to diagnosis compared to males. The delay was 8 months versus 4 months. And the implications of later diagnosis means more untreated inflammation and damage and potential vision loss. And Takayasu's, the other large vessel vasculitis, primarily affects young females, often during childbearing years. In terms of the blood vessels involved, females have more upper limb, subclavian, carotid, and generally supradiaphragmatic involvement compared to males, who have more iliac, renal, and abdominal aortic involvement. So gender does play a role in the pattern of vascular involvement, and we're not really sure why. One of the most difficult issues in Takayasu's is the delay in diagnosis because of some of the really non-specific symptoms, such as dizziness, fatigue, malaise, tenderness over the carotids. And for women presenting with these non-specific complaints and variable levels of inflammatory markers, it can be difficult for providers to make the diagnosis. Even once the diagnosis is made, these women have to undergo repeated screening MRAs and, of course, use immunosuppressive medications to control the inflammation. And for women, especially young women who are primarily affected, this can lead to many undesirable side effects, along with risks associated with pregnancy, especially if the disease is not tightly controlled. One interesting study looked at over 200 patients with vasculitis to see how they access healthcare information. They found gender differences in medication information sources. So male patients primarily asked their spouse or partner for guidance and rated them as more credible sources than female patients did. Females were more likely to use medication package inserts or the internet and are less likely to use nurses. And whether this reflects or impacts health literacy or patient outcomes is unknown. But because there are fewer large-scale studies in vasculitides, some of the differences in clinical presentation or genetic predispositions are yet to be figured out. But the community is engaged and committed to better understanding vasculitis and how it specifically affects females. One example of this is the VPreg registry, which is a source where we hope to gather data on vasculitis patients during pregnancy to better understand the disease and its interaction with an impact on pregnancy. So to wrap things up, we know that there are some gender differences in terms of who gets specific vasculitides, including patterns of blood vessel involvement. But larger scale studies need to be done in these rare diseases to better understand patient outcomes and why the discrepancies exist. The implications of delays in diagnosis from non-specific manifestations, as well as the impact on reproductive health, has a profound impact on females with vasculitis. Thanks so much for tuning in.